Our next topic is disruptive impulses, control and conduct disorder. Overview: disruptive impulse and conduct disorder are a group of disorders that link by varying difficulties controlling aggressive behaviors, self-control, and impulses. Typically, the resulting behaviors or actions are considered a threat primarily to others' safety or to societal norms. Disruptive impulse behavior, ito yung mga taong hindi nila makontrol ang kanilang malevolent behavior or aggressive behavior, which is a threat to other or give harm to other. First is oppositional defiant disorder. Diagnostic criteria. Criterion A pattern of angry, irritable mood, argumentative, defiant behavior, or vindictiveness lasting at least 6 months, as evidenced by at least 4 symptoms from any of the following categories, and exhibit during interaction with at least one individual who is not sibling. So, sa defiant disorder is may siya sang irritable and angry mood, which is ma-exhibit siya sa mga hindi niya relative, or which is hindi niya kapatid. Within 6 months, i-exhibit niya or makitaan siya sang at least 4 symptoms of bago siya ma-diagnose sa oppositional defiant disorder. So, number 1, angry, irritable mood or often loses temper, often touchy or easily annoyed, is often angry and resentful. Argumentative defiant behavior, often argues with authority figures or for children and adolescents with adults, often actively defies or refuses to comply with requests for authority figures or with rules, often deliberate annoys others, other blames other for his or her mistakes, misbehavior. So, nag-ano siya ng pala-discuss or ginaano niya ang mga authority. Grabe siya mag-discuss, then nag-blame siya sa other person sa iyang mga mistakes or misbehavior, or gabroke siya sa rules and regulations. So, vindictiveness has been spiteful or vindictive at least within past 6 months. This is revengeful siya. So, noted, the persistence and frequency of this behavior should be used to distinguish a behavior that is within normal limits from behavior that is symptomatic. For children younger than 5 years, the behavior should occur on most days for a period of at least 6 months, unless otherwise. Note criterion AB: for individuals 5 years or older, the behavior should occur at least once per week for at least 6 months, unless otherwise. Note criterion AB. While this frequency criteria provides guidance on minimal level of frequency to define symptoms, other factors should also be considered, such as whether the frequency and intensity of the behaviors are outside a range that is normative for the individual's developmental disorder and culture, gender and culture. So, sa criterion B, the disturbance in behavior is associated with distress in the individual or others in his or her immediate social context. Example, family, peer group, work colleagues, or impacts negatively on social, education, or other important areas of functioning. So, sa criterion B is naga-effect na ang ilang behavior sa ilang surroundings and sa family or sa workplace nila. The behavior do not occur exclusively during the course of psychotic substance use or depressive bipolar. Also, the criteria are not met for this disruptive mood dysregulation disorder. So dapat hindi siya mag-occur during sa psychotic, or hindi siya intoxicated sa substance. So para ma-meet niya ang criteria sa oppositional defiant disorder, specify current severity. Mild symptoms are confined to only one setting, so at home, at school, at work, with peers. So mild siya. Moderate, some symptoms are present in at least 2 settings. So severe, some symptoms are present in 3 or more settings. Specifiers, it is not common for individuals with oppositional defiant disorder to show symptoms only at home and only with family members. However, the pervasiveness of the symptoms is an indicator of the severity of the disorder. So, sa specification, hindi lang siya sa family niya nagapakita sa iyang symptoms or iyang behavior, which is ginapakita niya sa iba niya tao, like that. Comorbidity, higher in children, ADHD, conduct disorder, or childhood onset. So anxiety, comorbidity niya. So differential diagnosis, conduct disorder. Conduct disorder and oppositional defiance are both related to conduct problems, but that bring the individual in conflict with adults and other authorities figures. Example, teachers, work supervisor. The behavior of oppositional defiance are typically less severe. Sa oppositional defiant disorder is less severe, so hindi siya kaayo kalala, unlike sa conduct disorder. That is the difference. Problems of emotional, so which is anger and irritable mood siya. Wala siya gapanguba sa property or makaharm gid ng physical harm. So second, attention deficit hyperactivity disorder. ADHD is often common with oppositional defiant disorder. To make the additional diagnosis of oppositional defiant disorder, it is important to determine that the individual's failure to conform to requests of others is not solely in situation that demand sustained effort and attention, or demand that the individual is sit still. So sa ADHD is may ara siya sang So ADHD is wala siya ga-demand, or wala siya nagapangakig if na-provoke siya sa other people or na-reject siya, unlike sa oppositional defiant disorder, which is nagapangakig siya if i-provoke mo siya or i-reject. So third, depressive and bipolar disorder. Depressive and bipolar disorder often involve negative affect and irritability. As a result, a diagnosis of oppositional defiant disorder should not be made if the symptoms occur exclusively during the course of a mood disorder. So hindi siya ma-diagnose with oppositional defiant disorder if may ara sa mood disorder. So disruptive mood dysregulation disorder. Oppositional defiant disorder shares with disruptive mood dysregulation disorder the symptoms of chronic negative mood and temper outbursts. However, the severity, frequency, and chronicity of the temper outbursts are more severe in individuals with disruptive mood dysregulation than in those with oppositional defiant disorder. That only a minority of children and adolescents whose symptoms meet criteria for oppositional defiant disorder would also diagnose with disruptive mood dysregulation disorder, when the mood disorder is severe enough to meet criteria for disruptive mood dysregulation disorder. So, disruptive mood dysregulation disorder is same na sa lasang conduct disorder, which is medyo severe ang ilang symptoms. A diagnosis of oppositional defiant is not given even if all criteria for oppositional defiant disorder are not met. So, intermittent explosive disorder. Intermittent explosive disorder also involve high rates of anger. However, individuals with this disorder show serious aggression towards others that is not part of the definition of oppositional defiant disorder. So, ang interment is nagpakita sa sang do serious or something makaharm siya sa other or serious aggression. Unlike sa oppositional defiant disorder. So, intellectual disability, intellectual developmental disorder. In individual with intellectual disability, a diagnosis of oppositional defiant disorder is given only if the oppositional behavior is markedly greater than is commonly observed among individuals of comparable mental age with comparable severity of intellectual disability. Language disorder. Oppositional defiant disorder must also be distinguished from a failure to follow directions that is the result of impaired language comprehensive. Examples: hearing loss. Social anxiety disorder, social phobia. Oppositional defiant disorder must be distinguished from defiance due to fear of negative evaluation associated with social anxiety disorder. So, social is specific, nahadlok sa tao. Etiology and causes: temperatural, environmental, genetic, and physiological. A number of temperature problems in emotional regulation. Example: high levels of emotional reactivity, poor frustration tolerance, environmental harsh, inconsistent, or neglectful child rearing practice. Sa environmental, parenting practice plays an important role in many casualties of the disorder. Genetic and physiological. A number of neurobiological markers. Example: lower heart rate and skin conductance reactivity, reduced basal cortisol reactivity, abnormalities in the prefrontal cortex and amygdala.